Copyright in these lectures is either owned by the ANU or a third party who has licensed the ANU to use it. Students may use the recording for personal study only. No lecture may be communicated online, copied or shared without the prior permission of the ANU.
I'm really loath to interrupt because everybody seems to be having such a good chat. But it is after 11 now. My name is Judy Pudd, as most of you would know. I'm a research fellow in the Department of Pacific Affairs. Welcome to the third in our seminar series. Ningada Dinditaura, Nunawalban, Inju Mara Linjinyin. Our presenter today is Dr. Gemma Malungahu, who very kindly has agreed to present this morning, despite the fact she's chairing 2 sessions at the Pacific Migration Workshop, which is being held down the road here. So she will give this presentation and then head off down there. So I'm really grateful both for her to be here giving this seminar and for you all to be here as well, because we did have competition with this migration workshop, which we weren't aware of when we set the timing for this. So Gemma has a doctorate in health sciences and her research interests include Pacific health, Pacific research methods and methodologies, and Tongan culture, language and heritage. This seminar is not being audio recorded, but before we start, would you mind turning off your phones? It was interesting to see how many people were on their phones at the session I was just at the Pacific Migration Workshop. So if you could please turn them off as a courtesy. And if you could hold off answering questions until the end of her presentation. Thank you very much and welcome, Gemma.
Malalei, and thank you, Judy, for the nice introduction and the welcoming, and for also organising the research seminar series. Malalei, ki moe ke whai haki I talanoa whekau aki mo ki I whekumiko ne whai I New Zealand, o ku maho I ngā peto ke Aotearoa ke o tamo atu koe whakawhitai mo whakamalo ke otua. Ko hi kone tauhi mo ne whaki mai ai ilo mai poto ke Aotearoa ke whai aki ai ngā hinga o e koe o ko kau ki ai. This was the title of my research, Too Little Space. And not only does it speak to the limited space that we have in terms of the physical structure of the house that leads to overcrowding, where 2 in 5 Pacific people live in overcrowding situations in New Zealand, but it also speaks to the limited space that we have at a political level, where there's not enough Pacific representation or voice being represented at the higher up level, leading to poor housing policies being developed and therefore impacting Pacific peoples. The inspiration behind this research was growing up as a young girl, being born and bred in South Auckland in New Zealand. I came firsthand to experience what poor housing is like. I moved from state housing to state housing, lived with grandparents and aunties and uncles, which is nothing wrong with that. But it was, as a young child, I didn't really understand the dire situation that we're living in terms of unstable housing and unaffordable housing as well. So I was also part of this research project that looked at rheumatic fever experiences of Pacific and Māori peoples. And having talked to a lot of the families involved in that research project, I come to understand that a lot of the issues of their rheumatic fever experiences was because of the housing situation that they were living in, where some of them even told me, asked me actually, if I could support them in the applications to state housing because the landlord that they were under in terms of the private rental market wouldn't renovate their house because they were living in cold, mold and damp housing. And so it's these types of situations that I really wanted to bring to the forefront of my research for my PhD. So I wanted to look at the experiences and perspectives of Tongan peoples living within South Auckland, as well as interview some key housing informants who are in the policy level, policy decision-making arena, and get their views on the impacts of these policies among Pacific peoples in New Zealand. So the link between housing and health is not new. Evidence indicates that there is an association, there is a correlation between overcrowding, cold, mold and damp housing, and that of rheumatic fever, but also other housing-related diseases such as respiratory illnesses, skin infections such as scabies as well. Pacific people, compared to other ethnic groups within New Zealand, have the highest rates of rheumatic fever and rheumatic heart disease. And I'll talk a little bit about what rheumatic fever is later on. Primordial prevention is better than cure, where I felt that it was important to look at the upstream causes rather than focus at a more treatment or responsive or curative intervention. Housing policies in New Zealand also tend to favour non-Pacific and non-Māori peoples compared to Pacific peoples, and we continue to be overrepresented in poor housing conditions. My aims for the research project were twofold. The second one was that I wanted to develop a policy model to help address the rights of Pacific peoples to adequate housing in New Zealand. These were the 4 objectives that helped me to achieve those aims. So like I said earlier, I interviewed Tongan families and also interviewed key housing informants, both people from the central government as well as the local government, and people working within the private housing sector as well as people working in the non-government housing organisations as well. So rheumatic fever is an autoimmune response, so it usually occurs after you have a sore throat, so an infection that you get from a bacteria called strep A. After this bacteria infects the throat, it can lead to rheumatic fever, and if a person does not get diagnosed, and if they continue to have untreated and prolonged period attacks of this bacteria, it can lead to rheumatic heart disease, which is usually unpreventable, because then you have to go through surgery to replace your heart valves. So it is a really quite a serious disease once it gets to that stage. So therefore the importance of preventing people from getting rheumatic fever in the first place, hence my decision to focus on housing. There are socioeconomic and ethnic inequities where people living in low socioeconomic status, people of Māori and Pacific ethnicity have a higher vulnerability in getting rheumatic fever because of our tendency to live in high deprivation areas and also other factors as well. At a global level, we see here that compared to other countries, Australia and New Zealand, and the circles represented by the purple, they represent Indigenous peoples being affected by the prevalence of rheumatic heart disease. So in New Zealand, it's Māori, including Pacific, which is like the second highest at a global level, as well as Aboriginal and Torres Strait Islander people here in Australia. These rates, prevalence rates, are also quite similar to those we see in PNG. So rheumatic fever is actually coined as a third world disease, and it's quite embarrassing that in New Zealand, being a developed country, that we see that Pacific peoples and Māori people have high rates similar to those or worse in developing countries. At a more national level, we see that the over-representation of Pacific people having rheumatic fever in terms of the high rheumatic fever hospitalization rates in New Zealand. So we see that in the bottom blue line, the overall national population being diagnosed with rheumatic fever on their first going into hospital was very low compared to that of Māori and Pacific. We can see a general decline over time for Māori and the general population, but for Pacific we see it's very unstable, and that still more needs to be done in terms of the rates of rheumatic fever. This was recent data that was taken from the Ministry of Health, so it is quite upsetting that the rates haven't really changed since 2004, 2005, despite having some policies being implemented to help reduce overcrowding and also other initiatives that are being put into place to help improve, diagnosing rheumatic fever as well and increasing access to primary health care. So it's okay, come in. It's just annoying for me as a researcher who's very passionate about this, seeing the bloody high rates among Pacific compared to other ethnic groups. At a more district regional level, we see counties Manukau here that's highlighted. We have the highest rates of rheumatic fever as well out of all the other DHBs. So there's 21 district health boards within New Zealand, and counties Manukau, where the highest proportion of Pacific people reside, we have the highest rates of rheumatic fever hospitalization compared to other DHBs. So despite a somewhat decline, we still see that it is still quite high relative to other DHBs. This is an example of housing in Aotearoa, which is a suburb in South Auckland. And we see that this is a state housing house. And the picture there on the right is an example of makeshift housing for families who don't have enough room in their house because of the ill-fit housing design, and also the rising housing costs in Auckland and the shortage in housing supply. People living in their garages, and I'll be playing a video later on where people are sleeping rough on the streets as well as living in their cars. So in terms of the housing situation for Pacific people, we don't have access to affordable and habitable living conditions. Most of us are more likely to live in state housing or public housing, and that there's not enough houses that actually are suitable to fit our preferences as Pacific families. So most of us, it's normal for us to live communally, to live with multiple generations, to live with our grandparents and grandchildren, and to also live with multiple families. But yet a lot of the housing designs in New Zealand, and those that are affordable and that we have access to, are actually being designed for nuclear medium families. So usually around 3 bedrooms, and that's not near enough for our Pacific families. We also have low rates of home ownership compared to non-Pacific ethnic groups. And even now we see that from 2008 to 2019, the rates of access to home ownership had decreased by 90% for Pacific people. So there is a severe housing deprivation that we see among Pacific and also among Māori. This is the home ownership rates that I was talking about. This is from data from 2006, where I wanted to also showcase the home ownership rates among Tongan as well. So it is quite low compared to the New Zealand population at 18 or nearly 20%, and it's quite similar to that of Pacific peoples in 2006. And then we see the decline in 2013. Unfortunately, I don't have data from the 2018 census because of the issues with the data collection in our new 2018 census, and so I wasn't able to include that here. But I wouldn't be surprised if we see a decrease in home ownership rates as well. This is a table showing the percentage of people who are renting, and we can see that the people who live in state housing, Housing New Zealand Corporation, which is state housing, the majority of, nearly half of the Tongan population are renting in a state house. A similar percentage across for Pacific peoples, and then a lower percentage still for the New Zealand general population. So there are 4 main types of inequitable housing policies that I was able to have a look at and analyze in my research. And the first was privatization policies, where a lot of the state housing profile had become privatized and they were being marketed at a private market rental price. So it became very unaffordable for people who couldn't afford going into the private market rent in the first place. There was also this issue of the reduction of state housing profiles, where an effort for the government to try and reduce their responsibility in providing social housing for vulnerable groups, they had actually sold off a lot of their property to the private developers for them to improve it and renovate it and then sell it at a much higher price. Increased supply policies. These policies were introduced by the Liberal government. So what they had done was they had promised that they would increase the supply of housing, but there was no guarantee in terms of the proportion of those houses being sold off at an affordable price for Pacific peoples. And then there was no guarantee in terms of how they were going to measure the affordability for Pacific. So usually they would base it off the median income of the general population, and neglect to use the median income of people who are vulnerable, such as Pacific and Māori. There was also this relocation policy where in 2016 the government had put in this initiative where they incentivized people and targeted vulnerable people who were with low income, who were Pacific people, who were in the state rental sector, to incentivize them to move out and relocate out of Auckland. So if you think about the impacts that this can have, where it would lead to a displacement of families, where they become isolated and there's a loss in connection with their traditional social support networks, children's education becomes disrupted, there's no guarantee that the new place that they'll be moving to would have an employment suitable for those families to be able to make a livelihood. So it was all these different facets that weren't taken into consideration by the government at the time when they had put those initiatives in place. I wanted to showcase a YouTube clip that shows the dire situation of the impact of these poor policies on families who are vulnerable and have become homeless. And this showcases a Tongan woman there who has moved out with her elderly grandmother and her three children, who have moved into their car because they couldn't afford their rent. And then after having gone through the application process for temporary housing, they were able to access housing through at a motel accommodation. But having gone into that motel accommodation, they would have to pay back using that housing, temporary housing. And unfortunately, it wasn't until after the showing of this video publicly, then they were able to finally get into state housing. They were being prioritized on the list. But had they not gone to the public media, then they would have stayed in that poor, dire situation of housing. So I'll play that video now.
This is what we've opted to live in for the last 6 months.
When the house Alicia Fina was renting sold, she was forced to move out. She couldn't find another house she could afford, so her elderly mother and 3 teenage children moved with her into this car.
I want to take my family back on the street today.
Soon after, her daughter was taken by social services. 6 weeks ago, exhausted, they moved into emergency housing, a motel unit near the airport.
I know we're not in the van anymore. We're under a roof, but it still feels the same because it's not our home. I don't know what's going to happen. I don't want to lose any more of my kids due to being homeless. This is where we live, me and my 6 kids.
At a nearby house, we meet Hope. She prefers we don't use her real name. She's also a victim of Auckland's housing price boom. She says friends are letting her stay with her 6 children, one of them autistic, in this derelict garage while they wait for social housing.
Since we've been here, my little one's been sick, so my kids are healthy kids. Yeah. But since we've been in here, she's been sick. It's because of the cold and the damp, and I wish that I can do better for my kids.
According to the University of Otago, homelessness in New Zealand is now at record levels, with more than 40,000 people living rough or in garages. The idea of equality, equal opportunities and the fair distribution of wealth has long been a core value for most New Zealanders. But here in Auckland, the rapid rise in house values and rents and an acute shortage of social housing means that for many families, like the one living in this garage, housing has become a huge challenge. For many, it's too much. We found dozens of families sleeping in their cars next to a park south of the city. They were unwilling to talk to us on camera, but told us that despite having jobs, they were still unable to find a house to rent.
Where house prices rise, in the last few years, for example, are up 85%. And for most of that time, rents didn't rise nearly as fast. But just in the last couple of years, it's starting to overflow into rents. And that's putting enormous pressure on those people who have relatively low incomes and incomes that aren't growing very fast.
While social services have struggled to keep pace with the crisis, local Māori have opened their doors, taking in 160 people in the last 10 weeks.
When they arrive, the families are absolutely depleted. Some of the parents have slept for a day or two while they've looked after the kids. Some of the kids are sick. They're all very, very hungry. And the chance to sleep in one place in a bed here at the marae is a blessing to them, and you can see they're relieved.
The rapid rise in rental prices is affecting all Aucklanders who don't own a home, but Māori and Pacific Islanders are the most vulnerable.
82% of Pacific families do not own their own homes. They rent either from the government or from private landlords. And so when you see rent going up, increasing at huge amounts, it actually disproportionately affects Pacific and Māori families.
When a landlord decides to sell a house, they often do it quite quickly. So the turnover of rental properties in New Zealand is very high. That's less than 18 months. So that means people are continually bouncing from house to house. That means housing is very unstable, often it's incredibly poor quality. It flows through to very high rates of chest infections, skin infections, overcrowding.
The government has responded by promising to spend $1.3 billion on building around 6,000 new social houses over the next 5 years. It's a decision the opposition Labour Party says is in direct contradiction to the government's plan to sell off social housing.
We know that the stock of state houses in New Zealand was up at about 69,000 at one time. They are now wanting to sell 9,000 of those state houses at a time when we have such a huge shortage of houses.
Despite repeated requests, the Minister of Social Housing, Paula Bennett, herself once a beneficiary, declined our request for an interview.
On New Zealand back in the days, it was a lot easier than it is now. For the families that I have met out on the streets, they all shouldn't be on the streets at all. We all should be in our own homes and not relying on the streets to survive.
Just a few days after we filmed with Alicia and Hope, and we were told as a result of it, both their cases were given priority and they were offered social housing. They're both due to move in the coming weeks, but for hundreds of other families, the wait continues. A long winter without a home. Tarek Basley, Al Jazeera, Auckland.
Unfortunately, this story is not an uncommon theme among Pacific peoples, and it's the harsh reality of the dire situation of the housing crisis in Auckland. And New Zealand, being initially seen as the land of milk and honey, obviously does not provide as much opportunity or equal opportunity anyway for Pacific peoples in terms of access to adequate housing. So I would like to move on from that. That was some of the background that I had going into my actual research. This video was taken in 2016, which was at the beginning of when I started my PhD. And it was during the time when the Liberal government was still in power. And during my PhD, there was that transition from the Liberal government over to the Labour government, which we now see that some changes have been made since then, but obviously still more needs to be done for Pacific people. So my research was predominantly qualitative in nature, and I utilised the time-space or the Tāwā philosophy that was developed by Agustina Mahina in 1999. I had a meeting with him a few times to talk about how I could use this philosophy and how it could inform my research, which is good, and he also helped me to understand how it can be applied. There has been little documentation available to showcase how we can actually apply it at a practical level, because it's very highly conceptual. But I was able to develop Tāwā questions to aid the data analysis of my findings. These are some of the reasons why I wanted to choose the Tāwā philosophy over something like grounded theory or another Western approach The Dāwai philosophy honours and prioritises Pacific languages and Indigenous cultures, acknowledges the different arrangements of time and space across and within different groups. And it's also very holistic and encompassing, where we also take into consideration the importance of relationships and connections with our people. When even before carrying out the research, during the research, and then even after during the dissemination process. Ethics was gained before any data was collected. Altogether, there were 12 family interviews that I had undertaken with Tongan families. Because of purposive sampling, it needed to be people who were eligible in terms of meeting a criteria. And that criteria was that a family member within the household needed to be diagnosed with rheumatic fever. They needed to self-identify as being Tongan, and then also living in South Auckland. For the key housing informant interviews, informants needed to have experience working with Pacific peoples, but also have experience working in the housing sector, whether that be the central government, local government or non-government housing organisation. Recruitment was done via word of mouth, so I went to churches in Auckland, to Tongan churches. I first asked if I would be allowed to go in first and go in and do a speech. And I went in and everything was done in Tongan, and I did a speech in front of the congregation of several churches, and people who were interested in the research did follow up, and I provided my contact details and some information about the research as well. I feel that for our Pacific peoples, recruitment via word of mouth is more appropriate rather than sending out an email or having a pamphlet or an advertising sheet be put out. I also, like I mentioned, I developed Dāwai questions to aid the good analysis of the research, and then after, I also used the in vivo software program, which allowed for a more rapid analysis of the findings and helped with the storage of the transcripts as well. So in terms of the findings, this is a photo that I wanted to include. It's a photo of my little brothers and sisters. They're actually my cousins biologically, but I call them my little sisters and brothers. And I also live with them at home. There's 17 of us at home in Sydney. And so, like I said before, we prefer living communally, so hence the 17 people in our household. This is when they were really young. I didn't ask them for permission to use this photo, so I hope they'll be okay with me using it today. So one of the overarching themes from the findings was this importance of tauhi wā moe otoa. So tauhi wā moe otoa means a person's relationship, or the importance of nurturing relationship with God. So as you know, for Tongans, we're highly, very conservative. We are very much a religious affiliated ethnicity, and it came by no surprise for me that a lot of them talked about a good home meant that a family was able to nourish and nurture their relationship with God, and also raise their children in a godly way as well. There was also the importance of vālele. So vālele meaning having good relationships between family members, and noho whāutaha meaning togetherness or unity in terms of decision making. This was mostly came from the parents, where they talked about the importance of their relationship as parents first and foremost, and then being able to parent their children properly as well. Tauhi wā moe gagaia was also another aspect where it was important for them to nurture their relationship with not only God but also with people around them. So that included their neighbourhood, the community in which they were from as well. Another theme that families talked about was the influence of physical vā. So physical vā meaning the structural building or the structural house itself, where if they were moved, if the State Housing New Zealand House gave them notice where they needed to be evicted, or they were being moved or displaced to another house, they found it difficult to maintain social relationships with their family and their social support networks if they were being moved quite a distance away. So vā mama'o meaning far distance. So it also relates to having a disconnected relationship with others, and vaofi meaning living in close proximity. So there was a preference for living in proximity so that it'll be easier for them to nurture their social relationships with each other, with their families and community. Habitability was also another aspect where they needed the place to suit the needs of the family. So if they were able to live in a bigger house, they talked about how it would be accommodating, because then they would be able to fulfill their social obligations to family by having family gatherings at home, church functions at home, holding feasts and things like that. So it was important for them to have a house that was open plan, but also was able to accommodate for their family size. On the other hand, other negative themes that came up was this ongoing tension and conflict and the issues of institutionalized racism, where some people felt that their voices weren't being heard, particularly when they were asking the estate housing provider to come and have a look at their house, whether that be issues of running water or issues of the electricity not working properly. And there was this issue of delayed maintenance, when there was this one family I remember distinctively saying that they waited up to 3 years for Housing New Zealand to come back home and change the hoist because her child was paraplegic, and she got injured because of the heavy lifting of her daughter. And so it was simple things as that couldn't be followed up by Housing New Zealand Corporation, which is the state housing provider in New Zealand. There's also issues of poor access into the private market, where some families felt that their applications were being disapproved based on the fact that their last name sounded Islander. Some of them being denied access into a house because they had too much people in their family. And so some of them found that they had to lie and put in a false number of people that would be living in their household, just so that their housing application was approved in the private market. There was this issue of victim blaming, which I've got a quote in the next slide, where it shows a family being blamed for making a hole in their wall. And really, they were being blamed because Housing New Zealand people who came to see this issue had said that, this was caused by one of the children making a hole in the wall, where in fact it was actually caused by mold and damp housing, where the walls had started to weaken the structure of the house. So this was the quote that the family had shared with me. This was one of the sisters of a girl that was affected by rheumatic fever. They told us that we had to pay for the hole in the wall to be fixed. When the hole was small, Mum reported the issue straight away. She reported the issue so many times that the hole got bigger and bigger. She tried to cover the hole, but I could still feel the cold air coming in, especially at night time. Housing New Zealand said we had to pay for it because apparently we caused it, but I said this was caused because the house is damp. When it rains, it makes the walls damp, not because all of a sudden we decided to make a hole in the wall. My sister was angry. She wanted to sue Housing New Zealand because if it wasn't for them, I wouldn't have rheumatic fever. So this is quite an interesting case, because what happened is, despite the mother having called up Housing New Zealand to come and have a look at this, it got worse over time. And so there was this blaming game where they blamed, Housing New Zealand had blamed them for making a hole, and then there was also the other blame going back to them, where actually if they hadn't fixed the hole a lot sooner, then maybe things could have changed and maybe she wouldn't have had rheumatic fever in the first place. This is not the picture of the wall. I felt it was against confidentiality to actually put up a picture of the wall. I didn't take the picture of the wall of this, but this is just only one example of how a hole in the wall could occur due to damp housing. A lot of the state houses were actually being built between 1970 and 1990, and a lot of these buildings in the state housing profile do not have insulation, and because of that, it's more likely to be damp and mold. In terms of the findings from the key housing informants, a lot of the people who I interviewed were, because they needed to have experience working with Pacific people, the majority of them, 10 out of the 13, were actually of Pacific descent. So they talked about how there was this issue about pleasing the Western ideal, and that was in relation to this whole dilemma of, having to align with the values of the people that were around her, because there was often two people amongst others on the decision-making boards or the tables. It was hard for them to have a say or voice their concerns when it came to developing certain housing policies or initiatives. There's also a lack of government commitment, where there is no existence of a national Pacific housing strategy in New Zealand, which was one of the recommendations from this research, was to have a national level Pacific housing strategy that mandates set targets and commitments made by the government to ensure that Pacific people, or vulnerable groups anyway, have access to more adequate housing that's affordable, that's accessible, and so forth. There was this issue of ingrained political hegemonic essentialism, where even though some of the policymakers had access to the Gabasa framework, which is a Pacific policy tool that was developed in 2017 actually by the Ministry of Pacific Peoples, they chose not to use the Pacific framework tool to inform better decision making from a Pacific lens. And so it was quite surprising that despite having this tool available, they chose not to use it and just to go with the status quo of how decisions were being made. There was also an issue of personally mediated racism. So one of the informants that I'd spoken to had talked about how they have received a letter from one of the people in the public and saying to them that they're a coconut and that they didn't know anything, and that what were they doing, representing them at a local board. Or I've got the quote here. Individuals from my area wrote to me and said, "We don't want a coconut. Who are you? That blatant racism still exists, and you have to be pretty German to write me a letter." We were in a board meeting, and my Balangi colleague said to me, "Every time you spoke, I felt they didn't listen to you. And every time I spoke, they wrote things down and listened." So despite, in New Zealand, we call out racism. And despite having initiatives in place to help reduce the racism occurring in the workplace, but also in society in general, it's quite embarrassing and quite hard that to know that people are still out there who practice these types of issues that we see occurring. I think on the latter part of that sentence, it also speaks to issues of institutionalized racism, where there's this continual differentiation of access to resources and power among people, even in these types of levels at the higher up level of policy making. So if it's happening by people who are informing these policy decisions, then I don't know what else we can do to help reduce that. In saying that, one of the model that I had developed is called the Lolonati model. And it's a model about what it refers to. It means the making of coconut oil. And it's inclusive of 4 different phases. First is tātānaki. I think I'll skip straight through to that slide, because I know that people are looking bored. First is tātānaki, which means the gathering of stakeholders, so the gathering of the community as well, and making sure that we meet with community, engage with community, which is the second phase, which is tui fio. It's the engagement process of making sure that we engage properly with our communities and making sure that it's not it's not something that will be written and then left on the shelves to collect dust, but it's something that will actually happen, and there will be an implementation of the strategies. Sivimo Devdel is the prioritization of those strategies and initiatives that have been talked about during the Tui Fio process, and then Mili Mili is the actual application or the implementation of that policy. There are 2 main principles, manatoki api, which means remembering one's home, but it's actually beyond that, and that it also includes the need to be critically conscious, particularly by people who are making decisions, and understanding that their own biases and their own biases that they might have against other people who are vulnerable, and making sure that any decisions that they make, that they understand the impact that it will have on those vulnerable groups, particularly Māori and Pacific. Koe maho inga o whā ko he koe makapuna is the significance of love. So looking into the future and making sure that we make long-term decisions that will be of benefit for generations to come. I forgot how long my slides were. These are implications of the research as well. The priority for levelling initiatives is really important. So making sure that we adjust eligibility criteria for home loans so that we increase the number of home ownership rates for Pacific peoples, as well as that for state housing and the private market as well. It's also important that we reconfigure affordability measures that take into account individual household income of Pacific families, rather than basing it on the median income or the general income of a group or population. I was also recommending the need to develop a regulatory body that ensures that Pacific communities are being protected from exploitation, eviction and relocation, as well as displacement. So there were a number of recommendations that I thought were key. I just need to hurry up and publish so that people can actually use that in informed policy. So this is a summary of my little talanoa today. I hope everyone found this useful, somewhat benefited your own work, I don't know. But if you have any questions or comments, please ask me. I think I'll finish now. I've actually got 2 extra slides, but I think that's it for me today. Mālo bito.
Thank you so much, Gemma. Fantastic. I'm sorry you didn't have the time to go through it.
No. It's my fault. I talk too much. Any comments or questions about what I had just talked about? I'm open to any, even suggestions maybe, how to improve my presentation next time.